it's a great treat to be here to address you all. I'm always grateful for any invitation from Phil. He is one of the luminaries in toxics throughout the world, and any country, place that we work in, that we mention his name, people bow and scrape, and for that we're very grateful. Phil actually serves on the board of directors of Blacksmith Institute and has also been just an inspiration in helping us to define how we manage our mission, how we manage the programs that we're doing around the world. So what I'd like to do for the next 20 or 25 minutes is talk to you about Blacksmith and what we've been doing and what kind of activities that we do. When we started the organization about 12 years ago, we realized that there was a gap in what was going on in the environmental movement with respect to toxins in the developing world. There was work going on with biodiversity, there was activities on climate change, there was work that was happening in the developed world on toxins. There was nothing happening about dealing with toxic effects in the developing world, none whatsoever. And the first thing we decided to do when we elected that we would get into action with this work was to define ourselves not as an advocacy group, but instead as someone who would actually fix the problems. We wanted to be dealing with cleaning up toxic problems, making solutions so children wouldn't get poisoned, so we would fix these contamination issues. And we also elected that we would do this with very strong technical standards, to do it at US level, high quality, technical kind of levels of operation. So since that time, we've gone around the world implementing projects that have cleaned up toxic problems. Some of them have been about shutting down factories that have been polluting. Some of them have been about cleaning up dump sites that have been polluting, and many other different types of problems. But the ones that we've done, we can leave and now know that exposures to children, to communities in those areas are now greatly diminished, and their risk of public health problems are significantly diminished. And in doing so, having done this body of work so far, we've coordinated ourselves very tightly with governments in all of the countries we work, and also with the international community, which usually means in these countries the World Bank, Asian Development Bank, the Inter-American Development Bank, and the like. And all of those folk and the UN agencies around this area are quite closely tied in with all the work that we're doing. So I'll give you an example of one or two of the implementation projects that we've undertaken. But what I also want to show you is a broad-scale project that over the last 2 years we've been implementing to find out where are there places in the developing world where people are being poisoned from toxins. Where are there? How many of them are there? How many people are being affected? What are the toxins? And this global inventory process that we've been undertaking over the last several years has now got a body of data, and I'm going to show all that information to you. It's still a work in progress, but you get to see where we think these problems exist and how they can be solved. So some of the lessons that we've learned in doing this work, there's a lot of toxic hotspots out there, from active polluters, from legacy sites that are being abandoned. And for the most part, it's never a big Fortune 500 company that's responsible for it. It's usually a small local agency. It may even be some backyard guys. It may have been an abandoned government, even an active government factory that's had no pollution controls. But usually if Dow or one of the big companies is out there, Johnson & Johnson has a factory, their standards are much higher than the rest of the community, and they rarely cause toxic exposures. Most of the problems we find are abandoned sites where the people are long gone. And we find also that the health impacts in these locations can be absolutely extraordinary. Many of the places we work in, life expectancy is less than 40, and they're populations of hundreds of thousands of people. All of it because of exposures to toxic chemicals of different sorts. Let me give you an example of one where we've just finished phase 1 of a cleanup work. A place in northwestern Nigeria called Zamfara found a body of ore. First of all, it's a very poor Muslim rural area where people make their livelihood raising cattle. Adobe, mud bricks, very poor infrastructure, average per income per day about $1 a day. they found a body of ore that had gold in it, and they started to mine this ore using mercury to take the gold out, and all of a sudden people were able to make $4 and $5 a day. Spectacular, great thing to do. Then the emir in the region said, okay guys, let's go bananas with this. Take that ore, bring it to everyone's homes, have the women help in the family compounds to help to crush up the ore and extract this gold out. And when they did that and they started to throw the residual into the backyard, all the children started to die. And the reason was the ore had gold in it, but it also was as high as 15% lead. And there were very, very acute levels of lead exposures to these children, and well over 1,000 children died. Here's a map of the region. The reason that we found out about it was MSF came around on their biannual inoculation for vaccinations. And they came to a series of villages and there were no children to vaccinate. There were just rows of little graves everywhere. The locals didn't know what had affected their children. We were asked to come in and evaluate. They found out that it was lead. And since then, all of that process began, by the way, in March of 2010. Since then, we've gone in with people from CDC, with MSF again, with a group of experts and money from the UN, and we've dug up these backyards that have been contaminated in 7 villages. Over 2,000 houses have had their backyards decontaminated and fresh soil brought in, and that contaminated lead has been disposed of in landfills that we built in each of these villages. The children themselves have also been treated for lead poisoning with chelation, often several levels of chelation therapy, in facilities that have been built by MSF. There's been 17,000 people affected there, and hopefully these people will avoid recontamination. But here's one of the villages and scoping out what kind of levels of lead they had. The red shows lead at more than 40,000 ppm in backyards. Yellow is 10 to 40,000, and so on and so forth. So that's an example of one of the projects. This broad process of trying to scope out where toxic exposures exist around the world began in 2009. And we've done work now in about 40 countries, and we'll expand this to about 80 countries all over. It's a coordinated process where we're the lead agency. UNIDO is our assistant, for folk who know the UN agencies. And we're expecting to be doing this still for another couple of years. The purpose of it is to look at toxic hotspots wherever there's contamination that's affecting human health, not that's just affecting ecosystems, but things that are actually having an impact on human health in low and middle income countries. So this includes China, India, Russia, the Philippines, Mexico, all of Africa, all of South America, and so on and so forth. The only places where we're avoiding are places where there's ongoing conflict, like the DRC, Iraq, and so on. Places where there's no government, where we can't coordinate with a government agency. And places where there's already something going on where we think we don't need to provide any insight because they're already doing something similar, like the Balkan states and Turkey because of their soon-to-be enter into the EU. So countries where we're currently active are listed here, and there's many more to go, but the process where we do this in each country is formalized and standardized. And I'll go through how we go in and look at toxic sites and then put them into this common database with you. First thing we do is we go into the country, meet with the government agencies, tell them we want to do this, and then select a group of people in that country who we will train in the protocols of evaluating toxic hotspots. We do this usually with the government's request with their national university Department of Public Health or Environmental Science. And they will take their senior staff and ask them to be part of this project. So typically the people that are doing these assessments are masters or PhDs in one of the appropriate sciences. We then ask them to go out and look for sites that fit a particular criteria. First of all, we're looking for industrial and chemical problems, not bacterial. Bacterial problems abound everywhere. They're being dealt with usually through health departments. This is of chemical concern. We're also looking for sites where the health risk is not occupational. So it's not that people are living or working in a factory, but rather that it's people outside of that factory who are exposed. This for us is an important piece. We also look for toxicants that include the heavy metals. These are ones that no one has any objection that cause significant and substantive human health risks. The heavy metals, mercury, arsenic, chromium, lead, cadmium, are high up on the list. We also look at cyanide, PCBs, pesticides, POPs, coke, coal, VOCs, asbestos, dioxins, PAHs, PM10 and 2.5, so particulates are there. Oil and petroleum products of different sorts, the benzenes and different pieces of that. Fluorides, abandoned chemical weapons show up a lot, and radionuclides. This is our list of toxins that we know cause risks and health problems, especially in children, and this is what we direct our folk to go and look for. And as you know, the health impacts from these kinds of pollution are extraordinary. We have brain developmental issues from the heavy metals causing intellectual disabilities, organ malfunctions, cancers from radionuclides, maternal health, children's health issues from all kinds of other products. Hexavalent chromium causes all kinds of problems. And overall, exposure to toxins at levels that are elevated impact immune responses, and you end up with higher infection and mortality rates in these places. And the biggest tragedy in all this, as you well know, is it's all about children. With their smaller sizes, the dosage to body weight ratios mean that they get a lot worse hit, and their developing brains are a lot worse hit than adults. So we train these folk in each of these countries. We have a 3-day training process that was put together for us with Johns Hopkins University. It's a lot of work in identifying sites and evaluating the method of visiting a site, what kind of data needs to be collected, and so on and so forth. And we do it with field work as well, where they go out to a suspected toxic site and review it themselves, and we make sure that they're collecting the right kind of data. The assessment protocol mirrors the US Superfund protocols, and it looks at the basic process of a pollutant and then a pathway where there is access to human beings and that population that's affected. So those 3 Ps are the key kind of process for us. And for a site to be included into the database and for the information to be entered into the database, it must satisfy 2 critical things. First of all, the test results of whatever the toxicant found need to show evidence that it is elevated above international standards. Usually we're using EPA standards, so for lead in soil, it needs to be more than 400 ppm for us to consider the site. For drinking water, whatever standards are for whatever particular chemical is present, it needs to be elevated significantly. And for us, generally that means at least 5 times above the EPA standard. In addition, there needs to be credible evidence that that level of toxicant is getting inside of someone, so that there is a pathway where people are actually drinking that water, and then we need to measure how many people there are, and it can be credibly judged how many people might be exposed to that toxicant at that level. There's 100 field points that are collected when the investigator goes out and does this work. Lots of information about who's created the pollution, lots of physical information about the site itself, lots of photos, copies of reports, and so on. And they're all uploaded into the database. Oh, this green is from hexavalent chromium. That's skins that are being tanned in Uttar Pradesh. And to show you how the sites look, I've got a few examples I can show you. This is a site in Ranipet where they dumped 200,000 tons of chromate sludge from a manufacturing facility. Hexavalent chromium from that chromate sludge, whenever it rains now, runs off, and I'll show you some photos, down this drain here, and then into a field and a pond that's also bright yellow. The level of hexavalent in this particular view here is at 140,000 times the international standard. From here, it then runs into a wetlands where there's some crop growth. The crops themselves measure at about 10,000 times international standards. And through the other side, only about another 50 meters into a river that is the source of drinking water for the town of Sinai. Highly, highly toxic place. The information that we collect includes populations at risk, the test results that we take, Google Maps pop up automatically, lots of reports and charts and all the rest of it, all fed in online into this database. Here's another site in the Philippines, an abandoned battery recycling facility. These things show up all around the world. What happens is people will take batteries to a piece of open land, smash them open with an axe. They'll then pull out the plates, which are all gunky with lead oxide, which is why the batteries are no longer useful. And they put it into an open wok, and they'll use the plastic from the battery to melt that gunk in the wok. And they end up with about 30% metallic lead and 70% of this lead oxide floating on the top. They scrape off the lead oxide and throw it away, and then pour out the lead into an ingot and sell it. And they can make about $10 worth of lead from one battery. So it's a valuable source of income. But, first of all, the acid which they poured into the ground is full of lead and contaminates that local soil. But worse, this lead dioxide, when it's thrown away, gets very dusty very quickly, and it spreads through on the wind through the whole community. And you end up with about usually populations of between 10 and 50,000 people who have acute lead poisoning. And you'll find clusters of death within those areas for people who are living around. We had 60 children die in Dakar before we managed to clean up one of these sites. This particular site in the Philippines is being cleaned up right now. Again, the technical details are all collected here. And here you can see these plates on the upper right are the battery plates that people were using in their houses to walk on. And they're all heavily contaminated with lead. This little kid has found a piece of lead and is going to take it home to his dad so his dad can sell it. So when these sites are put into the database, we also want to find a way to be able to prioritize the intervention work that needs to go in to clean them up. And to do that, we've adapted, again, the Superfund protocols to give a very simple ranking of how bad one of these sites is. And this index, we call it the Blacksmith Index, is a very simple tool that can say this site is worse than another, and therefore efforts should go into cleaning this one up first. The number scores from 1 to 10, and it's basically a very simple formula, for those who like formulas, where you take the ordinal, the number of zeros, if you like, of the population that's affected, and then you take the number of times the contaminant is above the international standard, say it's 1,000 times. You take that number of zeros too, add those two numbers together. So you end up with a logarithmic scale where the higher the contamination, the higher the number, and the higher the population, the higher the number as well. And we've run this through multiple different scenarios through all of our technical advisory board, and it ends up creating a credible ranking system that's very simple to be able to process with this rapid assessment protocol that we use. By the way, we do a lot of QA with all of this work. Once sites are input, they go back through a review process in New York and through our technical advisory board through several steps to make sure that data that's input is credible and reliable. There's a lot of feedback in the field to do this. So once now we have all this data in place, it needs two things. First of all, it needs a lot of analysis for the purpose of being able to prove how large the scope of toxic contamination is around the world. And secondly, on a country-by-country basis, there needs to be a process of sitting down with the government and saying, how are we going to fix this, ranked based on the Blacksmith Index, and where are you going to get resources to fix this and technical support to be able to fix it? We're doing that latter thing now over the next 6 months in India, Philippines, Mexico, and Uruguay. The first process is undergoing with the help of Mount Sinai and Dr. Landrigan. And researchers in the Children's Environmental Health Center are reviewing the data to create a series of papers looking at the global burden of disease from toxins around the world. We've also created our own journal to be able to provide another capacity to be able to have people write papers and report on this particular issue. And the reason that we've done this is curious, and I'll show you in a second. But right now we're already up to 2,100 sites Unfortunately, this slide never shows very well, but you can see they're scattered all over the world here, where we found sites that fit our particular criteria. And if you look, when we look at a Blacksmith Index number that's above 7, you're at a place where you really don't want to visit. You certainly would never want to have any of your children go and visit. And yet 7 and up equates to about 35%. If we include the 6s in, we're actually looking at 2/3 of all the sites in our database show Blacksmith Index scores that are at levels that are really quite terrifying. Right now, we're showing in our database alone 56 million people who are exposed to toxins at levels that are dangerous. And the database is incomplete. And when we do very simple projections, the number comes to over 100 million people, of people that we're expecting to find polluted by toxins. 100 million people out there at levels that are so far above US EPA standards that everyone would be sued in a moment. 100 million people, how does that equate to the rest of the global health equation? Well, malaria, there are about 150 million malarial exposures, people who get malaria each year, and 1 million of them die. HIV, there are 34 million people who have HIV at any one time in the world. And I think around 1 million of those die every year too. TB, 14 million people have TB right now globally. So if we're talking here at 100 million people who are exposed to toxins, we don't know where the death rates or the burden of disease are. That research hasn't been done. But we're in the order of magnitude of something that has already reached that of large-scale public health initiative in other parts of the world and other parts of interest. Just to go back to where these contaminants come from, you can't see this terribly well, but what I want to show here is that all types of industries have a significant impact here. Mining and ores, chemical industry, the smelting industry, textiles, agriculture, industrial estates, naturally occurring is a small piece of this, which is the arsenic mostly in Bangladesh, and so on and so forth. There really is quite a broad spread of industries that are responsible for this. And this is to show you also that rather than considering just active polluters, where there's a factory that's creating something that's toxic right now, rather than an abandoned site where the factory's disappeared and there's a toxic legacy or a hazardous dump site that's been abandoned. In fact, the majority of sites combine both of those, where there's still some activity going on and an abandoned site around it where they've been leaving their waste or spewing their contaminated materials. So in any cleanup activity, that activity has to stop. There needs to be a way of managing active pollutants before you clean up the legacy. And both of those things need to go hand in hand when any of these implementation activities are moving forward. By pollutant, globally, the biggest exposure is from lead. In our 56 million in the database right now, 9.25 million people are exposed to lead at dangerous levels. Second is mercury, 8.2. The next is chromium, and actually mostly it's hexavalent chromium, which is famous from the Aaron Brockovich movie. That's showing at 6.4 million people. Arsenic at 4 million people. Pesticides, everyone thinks is the biggest problem. It's 3.6 million, not a trivial problem, but not the largest at all. And radionuclides follows close behind. They tend to cluster in different parts of the world according to what industries are appropriate. Lead tends to be everywhere because a lot of it is exposure from small battery manufacturing or small factories. Cadmium shows up in places where there's a lot of cadmium work, mostly in China. And chromium you tend to find wherever there are tanneries, which means Bangladesh, India, and Eastern Africa. We've also cut this data by continent in many different ways. In Africa, we have only 200 sites assessed, and we think it's quite poor coverage to date. But we can cut this by industry and by toxin in different ways. Similarly, in Latin America, the chart on the right shows how large the population affected is related to a particular toxin. And you can see there's a lot of exposures through the Andes from mining, as one would expect, and then in the industrial areas around Sao Paulo and so on. Eastern Europe, again, shows a lot of toxic exposures. In Eastern Europe, it's former Soviet legacy that causes the greatest burden of contamination to local populations. And again, as I was saying before, we're showing around 60 million in this database, and we are easily expecting that by the time this database is further along, we'll be showing well over 100 million people affected. We also briefly touch on how much it would cost to clean up all of these problems. And this is a conversation we have when we're talking to the international community, because we've already done 50 cleanups, and we know what it costs us to be able to do those things. And when we go through and look at levels of cost as an entree to the World Bank to say how much they might want to put into a pool of money to go and fix this problem, overall the numbers are not particularly large. It ends up being about $10 a person is enough to be able to cut these exposure pathways and stop this from ongoing contamination of local populations. So, just to wrap it up a little, there's a lot of places out there. There's probably going to be 3,500 toxic hotspots with levels of exposure that are dangerous out there around the world. The international community has very little knowledge about the scope of this. They're very focused on vectorial diseases. And it's mostly heavy metals. Heavy metals carries the brunt of exposures out there. And when you look at it too, don't think of the big international companies. Think of small, local, contaminated hotspots, local places all around the place, often even driven by people just trying to make a basic living, like those poor folk in Nigeria. And very little work has gone on to deal with this anywhere. And there's been also no activity by governments to try and deal with this problem as well. And in order to bring the international community in, the thing that we see as key is to really develop the research around the scope of this problem globally. And that's why we're very grateful to be working with Mount Sinai University. So thank you kindly. I'd be very happy to take questions from everyone.